Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 13 new cases of COVID-19, bringing our total to 217 cases. We are also reporting a third death today, and I extend my condolences to the family and friends. As of this morning, 12 individuals are hospitalized. Of that, 6 are in intensive care. We are listing 21 individuals as recovered. Public health investigations are ongoing, and as more details are confirmed, information will be updated on our website. Yesterday, 781 tests were completed at Chatham Provincial Lab, bringing our total to 14,280. We continue to remind all travelers returning to Manitoba that they must self-isolate and monitor for symptoms for 14 days upon their return. All returning international travelers, including from the U.S., in any form of travel, are required to do this under the Federal Quarantine Act, which carries stiff penalties for contravention. All people traveling from elsewhere in Canada must also self-isolate and monitor for symptoms for 14 days after their return to Manitoba. We know that still a majority of our cases in Manitoba are directly related to travel or close contacts of travelers, so it's vitally important that we have Manitobans adhere to this protocol to limit the transmission of this virus. In addition, now is not the time for any travel. All travel plans, certainly all non-essential travel plans outside of Manitoba, should be cancelled or postponed. This is to limit the importation of the virus into Manitoba. We know we've been requiring Manitobans to take significant precautions. The public health orders can be challenging for many individuals. We know these are challenging times for businesses, for individuals, but this is an important time. We are in a pandemic, and these measures are here to save lives of Manitobans. And we are asking all Manitobans to do their part, and it's a big part. All of us can make a difference to save lives, to flatten the curve, to interrupt the transmission of this virus. This includes not taking part in holiday gatherings. Easter and Passover are coming. This is not the time for family gatherings. Stay connected with family virtually. Ensure we're reaching out to vulnerable people. Now is not the time for family gatherings. We know that the virus can be transmitted in such gatherings. Protect yourself, protect others, protect Manitobans, protect our healthcare workers. Stay home. This is not the time for large gatherings. Spring is here, and with the change in weather, many people are trying to enjoy the outdoors, and that's fine. Regular exercise is important to our health. We need to maintain our health in general. This virus is not the only aspect to our health. But we have to adhere to the social distancing strategies at all times. Going for a walk around the block with your family, as long as you can maintain that 2-meter separation from others, great idea. Going to a crowded park, you need to turn around. Getting out and having this exercise in these areas are great, but if you're noticing the park is crowded, if it starts getting crowded when you're already there, you need to leave. We need to keep these crowds to a minimum. We need to interrupt the transmission of the virus. This applies to all Manitobans. We know the virus is in all health regions. We know that we've detected the virus at low levels in the community, so we cannot assume that the virus is not in your community. You should assume the virus is in your community. If you're aware of cases, stay home. Practice social distancing at all times. Wash your hands at all times. If you're not aware of a case in your community, stay home. Practice social distancing at all times. Wash your hands at all times. This is the time where we have the opportunity to flatten the curve. Really important message is to stay home when you're sick. And when we say sick, we don't necessarily mean feeling horrible. It's any symptoms. We know people with this virus have presented with very mild symptoms: sore throat, stuffy nose, cough. Even very mild symptoms, you need to stay home. Call Health Links if you feel you need to be assessed or have any questions, but do not attend the workplace, even with mild symptoms. We have seen this virus being transmitted by people with very mild symptoms. So if you have any symptoms at all, any respiratory symptoms, stay home. Interrupt the transmission of this virus. We remind Manitobans to keep up with their health, their underlying health conditions, stay in contact with your healthcare provider and follow their advice. Many visits can be done virtually, but ensure you're looking after your chronic conditions. We do not want people to have this unnecessary fear of seeking medical attention if it's required. Call ahead, seek advice, but ensure you're taking care of your other health needs. We've mentioned that fear and stigma can often be a great ally to viruses. I want to encourage everyone to get credible information from our website, Manitoba/COVID-19. Is an excellent site that's up to date to give credible information about this virus. Manitoba has a clinical trial ongoing right now to test a potential treatment for COVID-19. Those who are confirmed cases, those who are close household contacts of cases, or healthcare workers who are contacts of confirmed cases are eligible to enter. I'd encourage you to seek more information at covid-19research.ca. And I remind that we do not have a proven effective therapy for COVID-19 at this time. So we should only use evidence-based treatments and leave the determination of effectiveness up to clinical trials at this point. And as we make all these changes to our daily lives, as Manitobans are feeling some added stress due to this virus, I want to reiterate that we are not helpless, that we are all collectively taking actions right now to flatten our curve, to interrupt the transmission of this virus, and again to minimize the sad days like we have today. And so thank you to everyone who's been stepping up, and thank you to everyone who's about to step up. I'll pass that to Lynette.
Thank you. Good afternoon, everyone. As an update to the media yesterday, I wanted to just confirm that the first patients have now been admitted to COVID-19 units at the Grace Hospital, St. Boniface Hospital, as well as Health Sciences Center. These medicine units are isolation units for COVID-19 positive patients who require hospital care, but whose condition does not require intensive care. These units are part of our provincial coordinated response to COVID-19. Staff and physicians in these units are provided with appropriate personal protective equipment and are following strict infection prevention and control protocols as they put on and take off their PPE. I also wanted to let you know that infection prevention and control, as well as public health, are working together to investigate a respiratory outbreak in a medicine unit at HSC. 8 staff and 3 patients with symptoms have been tested to determine the cause of their illness. A test for COVID-19 was also included. 1 staff person and 1 additional patient, both without symptoms, have also been tested. All staff who are awaiting their test results have been sent home to self-isolate for 14 days, or if their COVID-19 test return comes back negative, or if their symptoms have been gone for 24 hours. None of the staff who have been identified were working while they were symptomatic. 3 of the 4 patients remain in hospital and have been isolated. 1 patient has been discharged. I just wanted to give you also an update on the assessment clinics and the community testing sites. So Manitobans are reminded to continue to seek care for chronic and episodic medical conditions. Primary care and community health offices continue to be available for those in need of care, and those might be virtual options by phone or by video, as well as in-person appointments and walk-in clinics. In addition, we are establishing assessment clinics for COVID-19 positive patients and patients who have respiratory symptoms that are in need of care. The first site is going to open tomorrow at the St. James Assiniboine Centennial Pool and Fitness Center. It will offer primary care services on an appointment basis for anyone who has tested positive for COVID-19 or who has respiratory symptoms such as a fever, a cough, a sore throat, or shortness of breath. In addition to offering primary care services in this clinic, the location will also be designated as a testing site. So the assessment clinic and the testing site will have separate entrances and be in separate spaces, and these are not walk-in services. Still have to make an appointment, go through health links, and or be referred by your primary care provider. People in need of care at the assessment clinics can be referred to their primary care provider or by health links for an appointment. And with the opening of the St. James Testing and Assessment location, the Access Winnipeg West will revert back to doing what they normally do and offering primary care and community health services. So Access Winnipeg West will no longer be a COVID-19 testing site. Similar assessment clinics and testing locations are being developed, and more details will be announced as they are confirmed. I do also want to let you know that Mount Carmel Testing Clinic is going to be closed during the statutory holidays, so Good Friday and Easter Sunday. So if you are planning to go to a testing site, you can visit one of the drive-in locations or the St. James Assiniboia Centennial Pool for testing over the weekend. And finally, just a word to everybody about mental health and wellness. So we know that these daily briefings have become a part of many people's lives in Manitoba, and the information that we share can sometimes feel unsettling or upsetting for some. And in addition to the primary care options that remain available for all Manitobans in need of healthcare services, I would also like to remind Manitobans about the variety of resources available for those who are feeling anxious or stressed. All Manitobans, including anyone who's working on the front lines in any capacity, needs to ensure that you're taking good care of your mental health. And regular exercise, eating well, ensuring you stay in contact with loved ones either virtually or by phone, all those things are important. But so is asking for additional support if you need it. So nearly 2 weeks ago, the province announced a new virtual therapy support would be available to Manitobans age 16 and over to assist them with anxiety related to COVID-19. Approximately 700 Manitobans have pre-registered for this program, and I'm pleased to announce that folks will begin to be notified starting tomorrow, and that the services will be available more broadly next week. So details on Ability CBT program are available at gov.mb.ca/COVID-19/bewell. And with that, we will open it up to questions.
Thank you. A reminder to our reporters on the line, we'll have a primary question and one follow-up, and please introduce yourself before you ask your question. From Global, Marnie.
Good afternoon, Dr. Roussin and Ms. Saragusa. Marty Blunt from Global News. Dr. Roussin, are you able to provide a little bit more detail on the third death, an age where the person is from, and if they had any underlying conditions?
Yeah, so this was a gentleman in his 60s from Winnipeg and did have underlying medical conditions.
And are you able to say if this case is connected to any of the other deaths in Manitoba?
I don't have any details about that.
Thank you.
From the Brandon Sun, Bud.
Hi, guys. This is regarding the temporary hospitals. I understand that you're looking at up to 2 facilities for a maximum of 120 people in total. I was wondering how you came up with that number, if it's based on a projection of some sort.
Yeah, it is based on estimates, and those estimates continue to be worked up over time. And the space needs we're hoping we actually won't need them, so it's really just about preparedness and planning in the event that we may.
Okay, so just to follow up then, so there's no time frame to actually start building, that is to be determined at a later date, in other words?
Yeah, right now we're just exploring where space might be available, and then we'll get into more details about what that space would be used for, what kind of people and staffing and equipment would need to be in those spaces. So it's just a preliminary look at what our options are.
We're talking new builds, right?
No, I don't think so. Are you talking about the RFP that was announced yesterday?
Yes.
Yeah, no, I think that's a request for existing spaces, but maybe new builds is an option, but I think it was mostly for existing spaces.
All right, thank you very much.
Thanks, Bud.
From CJOB, Diana.
Good afternoon. It's Diana from 680 CJOB. Just wondering, with regards to patients who have been hospitalized and those who've ended up in the ICU, how many actually tested positive before being admitted to hospital? Were they all kind of known to be positive for COVID-19 beforehand, or was it the case that there were some who didn't actually get tested until they were hospitalized?
That's right. So there's some in all those categories. I don't have the specifics, but I'm aware of people who had been tested before that had deteriorated, others that were diagnosed when they presented as severe. So it's a variety of situations.
Okay, and then as a follow-up, we're getting a lot of people asking about timelines for the virus. Understandably, something very difficult to predict. But if people are kind of trying to make long-term plans about their new normal, maybe they have a small business and trying to survive that, people are just really wanting to know about timeline. Is Manitoba any closer to kind of getting an idea of timeline today? And if not, when should people maybe expect to have a bit of a clearer picture of the timeline for COVID-19's impact here?
Yeah, so this is a difficult question because we're likely going to be dealing with this virus for some time until there is a vaccine. So in some way or another, this virus is going to be affecting us until we have a vaccine. So that could be much time in the future for sure. Where we're going to see our peak right now, it's still unclear, but it's still certainly many weeks that we're going to be dealing with this first wave, but really difficult to predict.
Thanks very much.
From the Winnipeg Sun, Scott.
Scott Billick, Winnipeg Sun. Question for Dr. Roussin. Can you just confirm that one of the patients that was in the ICU yesterday, like I think there were 7 yesterday, is that one of them that the third death today?
Yes. Yeah, it was a person in ICU.
Okay. Thing and the vaccine. I mean, I guess there's obviously no timeline on the vaccine, but is that what it's going to take? Like, I mean, even if we flatten the curve, do we still need to wait for a vaccine to come before, we can lift public orders and that sort of thing? Or is it still too early to even tell with that?
Yeah, it is. It's a little early. We don't know a lot about the long-term impact of this virus. Many viruses like this can sometimes have multiple waves. So certainly our priority right now has to ensure we flatten this curve to ensure that our healthcare system is not overrun, that we minimize severe outcomes. And so that has to be our priority right now, and that's still many weeks of this. What the actual measures we take in there, how they change, is still yet to be determined, because we're going to base that on what we see, based it on our epidemiology. But then going forward, it's likely that we certainly can't sustain significant social distancing for extended periods. So we have to find ways to be able to lift it eventually, and then match it with the epidemiology and adjust accordingly. So it's really early. A lot of these are based on predictions. We'll probably have some more views on other jurisdictions that have had their outbreaks before us, to see what it looks like if they see second waves. But it's difficult to predict at this time.
Thank you.
From CDC Radio Canada, Patrick.
Bonjour, c'est Radio Canada, Patrick Foucault here. I was wondering, will we see some random testing being done in Manitoba? And if so, how close are we to seeing that?
Yeah, so we're not, to be clear, we're probably not going to get to a place where we do random testing, if that means testing people without symptoms. There's very little benefit in testing people without symptoms. So our focus is going to be on symptomatic individuals. So we are testing, all symptomatic healthcare workers are certainly offered a test. People who are admitted to hospital with respiratory symptoms, and this is regardless of their travel or contact history, can be tested. This applies also in congregate settings, such as correctional facilities. We've talked about the same thing on First Nation communities. So we are doing some testing that doesn't involve risk factors such as travel or contact. We may look at ways of opening that up more to test more in the community, but it'll always be focused on people with respiratory symptoms.
Thank you. And I think the next one is for Mrs. Saragusa. Will we see that mental health support service online be available in French?
I'll have to look that up, Patrick. I'm not sure. I'll find out and we'll get back to you, okay?
Appreciate it. Thank you.
From CBC Manitoba, Bart.
Bart Kiva, CBC Manitoba. Dr. Roussin, could you comment on the University of Toronto modeling out this morning that suggests that most provinces, including Manitoba, are at or nearing the active case plateau?
Yeah, so I think that I did take a look at that, some of their numbers, but just quickly. So it does show that some numbers that may look like the peaks are being reached in some jurisdictions. Again, this is modeling. It's certainly Manitoba. We are early in our outbreak of this virus, so it's it's really early to comment specifically on Manitoba that we're at a peak. I don't think we are near our peak right now, but certainly I think it's reassuring. Look at a number of jurisdictions that the efforts being put in place, the social distancing strategies, the ones that we continue to speak about here, they do appear to be having an effect. So I think that should just strengthen Manitobans' resolve that what we're doing, even though it's challenging, it does appear to be working in other jurisdictions. So we should continue to double our efforts here.
And as a direct follow-up on that question, what evidence do you have? How can you tell that physical distancing is having an effect here in Manitoba?
Well, this is the one issue with it here in Manitoba is that we instituted our physical distancing strategies the day we had our first case. So we don't really have that curve or a change in the curve to rely on. So it's going to be, we're relying on the modeling from other jurisdictions to follow that. These type of strategies have worked elsewhere. And so, if we see that our numbers can remain relatively low, then we can have that kind of as a proxy that our interventions have been working.
And do you believe our numbers are relatively low?
Well, as of right now, it's because we're early on, right? So our numbers are we're certainly, in my opinion, not at our peak right now. I think we're going to see many more cases here in Manitoba, but we're going to continue with our efforts. We're going to escalate our efforts if necessary, depending on our epidemiology. And so we're early on. We've had our first case here March 12th, and so we're really early on compared to a number of those other jurisdictions.
Thank you.
From CTV Winnipeg, Michelle.
Hi, it's Michelle from CTV Winnipeg. Sorry, just one. Okay. Saskatchewan's chief medical health officer said yesterday that a lot of their COVID-19 can be traced back to individuals from the house going out to shop. Has Manitoba seen any community transmission that can be traced back to shopping?
That's not typically something that's been reported to me right now. We are working on a rather detailed analysis of our first cohort of patients where we might be able to pull out some more of that information, but we just know that this is the reason behind social distancing. It's really to stay home. When you're out, then that's where there's the risk of being exposed or exposing someone else. So stay home. When you are out, practice that social distancing, wash your hands frequently, but really the best way to protect yourself is to stay home as much as you can.
Okay. And then this might be for Lynette, but the temporary spaces for COVID patients, would they be for COVID patients or would they be for people who are not COVID patients? Can you clarify who those would be for?
So, Michelle, are you talking about what was announced yesterday?
Yeah, for the RFP.
Yeah, I think more discussion has to come with that, but they would be very low acute patients. So typically patients who are in the hospital who are waiting to go home, but maybe can't go home because the home care services aren't in place, or they need an IV and that's not going to work if they're rural and remote, or there's some kind of risk factor in going home, but they don't necessarily need acute care hospital, like medicine intervention necessarily. So it could be that there are COVID positive people who are just getting through the end of their symptoms, and then they would be separated from non-COVID. But yeah, I think, depending on how these numbers go, we're just going to have to be prepared to manage higher COVID volumes and making sure they're safe, they're isolated, and the public is protected as well. So yeah, high possibility.
From the Canadian Press, Steve.
Well, hi, Dr. Roussin. Steve Lambert from the Canadian Press. The Manitoba legislature is expected to reconvene later this month to deal with some of the issues they have to tackle with COVID-19. And obviously the issues come across all forms of government, from the Justice Department and others. But is there anything that you are looking for in terms of legislation to help you tackle COVID-19?
I can't say anything specific about legislation. I think that the Public Health Act already provides the the tools necessary to help us from a public health perspective with this. And so we know that a state of emergency has already been declared as well. So further efforts may come in the form of public health orders. Certainly the manner in which we can enforce those orders we're continuing to look at, but I can't speak to any new legislation or amendments that I've suggested.
Okay, and leaving aside the legislative angle, is there anything in terms of enforcement or specifics in public health orders you're looking for from the provincial government?
Well, most of the public health orders can come from my direction, and so we know that we have the current one has been in effect for just under a week now, and it's set to expire on the 14th. And so we'll going to be looking at what will be in a subsequent order. You know, certainly we're not at a place right now where we will be ending our social distancing strategies. And so certainly there's going to be some more work done on that, and those details are being worked out right now.
Thank you.
From City News, Stephanie.
Hi there, Stephanie Osuk from City News. Dr. Roussin, I'm just wondering, how can Manitoba compare its numbers with other jurisdictions for certain reports like the one coming out of Ontario when we're not testing as broadly as other jurisdictions are?
Well, it depends on the jurisdiction. We have, per capita, our testing is sort of mid-road in Canada. So we're doing that testing. And again, the testing is one aspect. And so we're testing all hospitalized patients and all severely ill patients. So certainly any of those are being tested, and certainly our proportion of severe cases or proportion of hospitalization is the same what we expect throughout Canada, and so we're not seeing any differentiation in that regard. And then again, our positive test proportion of our tests is fairly stable, and so we're not seeing that we're missing a lot of cases. So we're going to continue to try to increase our testing at the right times according to our capacity, but a lot of measures in place right now looking to that are showing us that we're not seeing a lot of severe cases compared to other jurisdictions.
Thanks. And then just for Mr. Ragusa, can you just talk about the assessment clinics a little bit more, what it will look like for a patient that's going in there?
Well, it won't be unlike the assessment clinics that we currently have, except it will be specifically designated for COVID-19 patients and those that have respiratory symptoms. So it will still be very much the same kind of service, same quality. It'll be by appointment, and that will allow the assessment clinics, the former ones like Winnipeg West, to just focus on the day-to-day, getting people through with just primary care and the episodic issues that they need to deal with. So just helping really streamline the population and keep a focus.
Thank you.
From the Winnipeg Free Press, Larry.
Larry Cush, Winnipeg Free Press. First question is for Lynette Siragusa. You were talking about a respiratory illness outbreak at HSC, and you mentioned 8 staff being sent home. Could you tell me, are those 8 staff, are they nurses, doctors? Do you have a breakdown?
It is a combined group of professionals, healthcare workers, and so I can't give you an exact breakdown, but it is a mix.
Is it mainly nurses? Can you tell me that?
No, I can't tell you that. Sorry.
Okay. Follow for Dr. Roussin. Do you have some information on hospitalized patients so far? Have they mainly been older and with underlying health conditions?
Yes, I think we're still working on trying to get get a detailed assessment that we can apply, but I don't know if I have the necessarily a percentage of that. So certainly the majority of hospitalized patients, and especially those in ICU, were in the older age groups and with underlying comorbidities in most cases, including respiratory, cardiac kind of conditions. So we're going to try to get a detailed assessment that we can provide, including things like average length of stay, the type of underlying conditions, and an age breakdown.
Okay, thank you.
All right, to our reporters on the line, we're going to open it up for questions. We have a few moments left.
Dr. Roussin, Bartley Kivas here at CBC. On Saturday, you mentioned that the death of the second patient, that person was not in the workplace while that person was infectious. Statements made by that person's family, by the school division, have suggested that that person was, in fact, working. Can you clear this up? Was this infectious? Should people have been notified? Were people notified? Can you please clear up what appears to be a disjunction here?
Right. Yeah. So again, my condolences go out to that family, and certainly the strength they showed sending out a message like that to Manitobans and helping reduce the spread of this virus. So certainly my condolences are there. From our investigation, from the public health investigation that was reported to me, is that during the infectious period, the individual was not in the workplace. And so that's why no contacts were identified there, and there was no determined not a need to notify the employer. And so in these circumstances, it would depend if the person was deemed to be infectious, but we could identify specific contacts and be certain that that was the contacts, we would just identify contacts. If we felt that there would be numerous contacts or some that we would miss, then we would notify, a place of business or an employer. But in this case, what's been reported to me is that the infectious period did not include the workplace.
Dr. Roussin, Larry Cush of the Winnipeg Free Press. Since you've started providing demographic breakdowns on the website, a couple of things have stood out. One, that the two greatest numbers of people with COVID in Manitoba have been first women in their 20s and men in their 60s. And this has been a consistent trend since you started posting these numbers. And I'm wondering, what do you make of it? And do you need to target the information to these specific groups?
Yeah, so I don't think there's much to be made of this. Certainly, we know that the COVID can affect all age groups. Certainly, from other jurisdictions, the children are vastly underrepresented in the numbers. But we've seen cases in all age groups, and I think our numbers were early on in the outbreak, so the denominator here is still relatively low. So I wouldn't make much of seeing these numbers like this. Certainly that age group is not representing the severe outcomes. And so we'll continue to watch these things, but this early on in the outbreak, I don't think there's much to make of those numbers.
And the 4 cases of who are under 10 years old, did their parents also have COVID?
There was certainly a number of them. I don't want to speak to all of them, but I am aware for sure of a number of them that were household contacts of cases.
Thank you.
Michelle from CCB. Wondering why open these isolation units at the Grace, St. B, and HSB now? What changed?
I think it's just the growing expectation. So we have been planning to open them. We've been stocking them and putting the equipment in place. So it was just really a matter of when was the right time to do it. And I think in the interest of protecting staff and protecting patients, and as we saw that community outbreak start, we thought now. I think, there's really only 2 patients at, I can even tell you, there's 2 patients at the Grace, 2 patients at HSC, and 1 patient at St. B. So, so it's still early, but we thought it was a good time to start now, and there's no reason to wait.
And how did you make space for these? I know you moved one medical unit to the women's pavilion, the old one. But how did you make space at the Grace and St. B?
Well, there is physical capacity at all the hospitals, so it's really just a matter of moving beds around and dedicating a certain space to it and saying that's the COVID unit. So there is a dedicated space, I believe, where mental health was previously before consolidation. That's at the Grace Hospital, and St. B just moved some beds around and found a dedicated unit that they designated as the COVID unit.
Dr.
Roussin,
all right. When you say this virus is going to be affecting us until we have a vaccine, and it'll be many, many more weeks for this first wave. Can you just kind of provide some reassurance to people who might feel hopeless by this statement? Like, what can they expect after that first wave?
Yeah, I mean, I think that there's still a number of things we don't know about this virus. But what we do know is that in other jurisdictions that have implemented strategies like this, we've seen the flattening of that curve. We've seen where their healthcare institutions were not over capacity, and so it looks like we could be on that trajectory, and so we need to double our efforts, do what we can. And so, like I said, now is not the time for fear. Now is the time for knowledge. Now is the time for action. But we do know that our strategies against this virus are not going to be short-lived. And so this virus is likely going to be around in one shape or another for some time in the future. But right now we need to focus on this initial wave. And in other jurisdictions that had the early outbreaks, we've seen their curves start to on the downtrend and haven't seen dramatic spikes again in those areas. So we don't know a lot about it, but we should prepare that we'll be dealing with this virus for the foreseeable future.
Dr. Free Press, Doctor, or this is for Lynette again. With that respiratory outbreak at HSC, were any of the health people or workers or the 3 patients, or I guess, were first of all the health workers treating COVID patients?
I cannot confirm that. Sorry, I can look into that, but I believe they may have been, but I would have to go back and confirm for sure.
Ms. Saragusa, can you tell me what supports are in place for people who get discharged from ICU?
Like regularly discharged from most people don't get discharged from ICU. Most people get discharged to a medicine unit.
And do you have a procedure in place right now for dealing with a long hospitalized patient that turns out to have COVID-19? I ask this because of what happened at HSC last week.
Do we have, sorry, can you repeat the question, Bartley? Do we have a process for?
Well, yeah, the repeated context. Healthcare workers I've spoken to about 7 that said that some of the chaos that was in HSC last week was a result of not realizing there was a patient already in hospital that suddenly tested after it had been in contact with many people. Is there a procedure in place for this now?
Well, if anyone has respiratory symptoms, they would be tested. And so I'm not sure if that was in the case that you mentioned last week. It was a long-standing patient who developed COVID-19. I don't think they've still figured out where patient 0 was. So that is continuing to be investigated, that specific case. But if there are patients who are having any respiratory distress and showing symptoms of COVID-19, then they would be swabbed and results would be reported.
Forgive me, that's not the question I asked. I mean, is there a plan in place for how you isolate staff, inform staff, send staff home? Multiple unions say they got different advice. Some people went home with no advice. Some learned days later. Some were called back quickly, even though occupational health was saying they should stay home. Is there a plan in place for this now?
I believe there is a plan in place. So if we find out that you've been exposed potentially to COVID-19, we will do the test. We will send you home to await the results of those tests. Depending on if you're symptomatic or non-symptomatic, you will stay at home until that test comes back. If you're negative and asymptomatic, you can come back to work. If you are positive and symptomatic, you stay home for the full 14 days until symptoms reside.
Scott Billick here with Winnipeg Sun again. There was a renewed call today from the province for different equipment, N95 masks, surgical masks. I guess the question for Lynette is that just standard today that they needed just a reminder, or as the province, are you guys just not seeing enough of that coming in from different businesses?
Yeah, well, a little bit of both. It is a reminder to provide some emphasis. We continue to experience challenge with procuring supplies just because the global market is changing, and you see it all over the globe, and Manitoba is no different. So we are constantly looking to make sure that we have enough for the long term. We're looking at donations. We're looking at local manufacturers, if they're able to support us in creating what we need, whether it be gowns or ventilators or masks. So looking at trying to make sure we can rely on Manitobans instead of rely on outside sources, continuing to have regular conversations with the federal government about those shipments coming in. So it's just we have to take a all hands on deck approach and go after every opportunity to make sure that we have equipment long term for our staff and protection of the public as well.
Thank you.
Dr. Roussin, Marnie Blunt with Global News. Sandbagging is starting up this week in different areas, and it has been said to practice social distancing while doing so. However, it is difficult to do when you're throwing a heavy sandbag and trying to stay 2 meters apart from others. Can you be specific as to exactly how people are supposed to social distance while sandbagging?
Yeah, and so there's our strategy is multifaceted, right? So we want to continue with the basics. So you shouldn't be there if you're feeling at all ill. So we don't want people showing up with even mild cough, sore throat, or runny nose. We want people to be able to wash their hands frequently. It should be alcohol-based sanitizer. Do this frequently. Avoid touching your face and eyes. And just keeping your distance as much as you can. So we know we have essential work going on still in the province. We know that we'll need to respond to flooding. So that kind of activity has to go on. But there's some safeguards that can be put in place during those times.
We have time for a couple more questions.
Michelle from CTV here. So essential businesses like grocery stores have been asked to maintain physical distancing. And so we've seen some stores respond with their own policies. But can you provide any clarity on whether or not there are specific limitations from public health on the number of people allowed in a retail grocery store one at a time?
Right, so there isn't a specific number. The orders don't apply to a number of people in there. Obviously, that would be a difficult number to come up with because there's such a vast array of different sizes of buildings that these take place in. So the big issue is that there must be strategies in place to ensure physical distancing to all their patrons, and so that's the key.
Larry Cush at the Free Press again on the respiratory outbreak at HSC. I'm wondering if any of the staff that were told to go home and self-isolate. Were any of those previously on a self-isolation order?
I don't know those details, but I can check.
Yeah, any details that the province can provide on that would be great if we could get that later.
Okay, sure. We'll look into that.
Thank you.
Thanks.
And that concludes today's media briefing. Thank you very much.
Thank you.